here at Uganda Cancer Institute, we believe communication is the first step towards achieving our goal together of the best treatment outcomes for the patient. And once the patient steps foot in the hospital at our reception desk, we give them all the relevant information that they have to know about the cancer diagnosis. And we do that through our navigation program. We give the patient information about what risk factors were there for this cancer to develop. We give the patient on the different investigations that we shall have to do for us to determine the stage of the disease that eventually will enable us to manage the disease appropriately as per the guidelines that we have. And we emphasize support from the family, support from the friends, for them to do the investigations. For example, one might have to do a CT scan, might have to do an MRI to enable us to stage the disease appropriately. They might have to do tumor markers. So we endeavor so much to communicate to the patient and their family to know the rationale as to why they have to undergo all these tests. Number two, we have family conferencing activities. Family conferencing, like it's still part of effective communication. We invite the patient along with the responsible family members and friends that have a role in deciding for the patient, with whom we share the information, or we share the challenge we have at hand, and we endeavor to come up with a joint solution together as a team, medical team, along with the patient and his family. Look, here we are. We have cancer of the prostate. It's at this stage. This is the treatment plan. This is how we are going to go about managing you. And this is the treatment that you're going to receive. And we hope that while you're on treatment, it will last for this duration. And these are the expected side effects. This is what we are going to do to address some of the side effects. Some of them you might experience them immediately. Others you might experience them in a couple of days after your treatment. And the others might be long-term. However, we also have this other challenge. So that effective communication that we have through family conferencing and navigation programs, it's very important in addressing mental health challenges. Otherwise, somebody will worry about the chemotherapy they are going to get, because they've heard out there that once you start chemotherapy, you're going to lose hair, you're going to have problems with appetite, you're going to have weight loss, But if we prepare somebody psychologically for this, and we also tell them we have remedies for all these things. Okay, some of them might experience them, whereas others may not necessarily experience all these side effects of treatment. The other program that we have counseling services. We have a trained and well-trained and qualified counselor, as well as a social worker who will help us address the mental health issues for these patients. Despite the fact that I have had an interaction with the patient, they will still require more time, or they will still require a whole team of the medical counselor along with the medical doctor. So we try to address the mental health challenges. Some of these mental health challenges are attributed to the social economic status. You have come and we need to do a CT scan or an MRI to stage the disease, but you do not have the resources, the financial resources. So we link you to our social worker who will help you navigate some of these barriers to address some of these issues. Yes, you're already worried about the disease, but at the same time, you are worried about meeting the costs of the investigations, supporting yourself when you're in treatment. So all those bring about stress, they bring about anxiety, they bring about worry, and they tend to have a cumulative effect on the mental well-being of our patients. Lastly, we have survivorship programs. Survivorship programs, it's a broad perspective of approach, but in line with mental health, we always invite ex-patients or former patients who have won the battle of cancer, who have gone through all the stages of treatment, and they have been declared cured of cancer. So we believe these are the stewards to give more hope to the newly diagnosed patients. That look, I was also having a cancer diagnosed with, say, breast cancer this year. I came to the hospital. The doctors took me through this. So they took me through the steps that I will undergo through. And I went through the chemotherapy. I went through the surgery. I went through the radiation therapy. And here I am. I'm alive and kicking. And I've gone back to my normal ways of life. So we believe that this peer-to-peer support between the survivors of cancer along with the newly diagnosed, when they interact, they're able to exchange information, but it also gives hope to the new patients diagnosed with the disease, and they also get tips on how to cope up with the diagnosis and the treatment.